Hello, I'm Dr. James Nill, Nill Family Chiropractic and Wellness Center, and today we're going to talk a little bit about what's called hip pain and sacroiliac joint pain and what the difference is. A lot of times when patients of mine complain of low back pain, they often point to this area right here. Now this is your low back, and this is what's called your sacroiliac joint. Sometimes they get confused this with hip pain also, and your hip is way down here. So when somebody points to the side, that's when I figured, okay, there's definitely something going on with the hip. But if they point to that little bone that sticks out, that's sacroiliac joint problem. And a lot of things that can happen in there, you can have arthritis, you can have sprain strain from a car accident, or just a segmental dysfunction, which is caused from having a short leg or flat feet, which can also cause that pain dysfunction to come up. Now hip pain, you're going to have a little bit more of a problem down here. A lot of the times you can see that it's a pretty deep socket joint. So you get a little bit of arthritis in here, or you can have a little bit of a capsulitis, adhesive capsulitis, which can actually help freeze that joint up. So what now I'm going to do is demonstrate how I treat both of these. Okay, the first thing I want to do to treat sacroiliac joint pain and hip pain is put some kind of a heat source on there. But what we're going to do here is use anodyne therapy. What it does is it actually has these little diodes in there that release a certain wavelength of light, 890 nanometers. That gets absorbed by the red blood cells, which in the hemoglobin releases nitric oxide. That nitric oxide is a natural vasodilator that actually opens up all the blood vessels that are in there and flushes out all the toxins and inflammation, which is causing most of the pain. So I'm going to go down here and put these right over sacroiliac joint and come on up a little bit more. Now she might feel a little heat because these diodes are closer together, but that's just a secondary effect to what we're trying to get. So she's going to lay here between 8 to 15 minutes, and then we're going to go on to the next part of the treatment. Okay, the next thing we're going to do is we're going to try to figure out which direction this pelvis wants to go. I can do regular palpation to feel a restriction in there, or I can do what's called applied kinesiology. And what it's doing is we're going to do muscle testing that actually sends a signal to the brain, and we actually get a weakness or strength in a muscle depending on which way the joint has to go. So what we're doing first is we're going to make sure she has a tight muscle, so go ahead and hold. Nothing there. So we're going to push this way, hold, it's still strong. We're going to push this way, hold, look at that, goes away. Let's try it again, hold, and it's strong again. So what we're going to do is we know that now that we need to do what's called counter-nutation and bring that pelvis this way to take pressure off that. In other words, we're going to put a little flexion in there. Now we can do that on her side, but first we're going to do is use this table. Now this table actually has a drop mechanism to it. It goes up and down. And what that does is it helps bring the force. Instead of stopping at the table, it brings it through the joint a little easier. So we go like this. Actually get that to move. Now we do the testing again. Hold. Okay, try this again. Hold. And it's fixed. You can see the muscle went strong again. Now we know it's good. Okay, the next thing we're going to do is side posture manipulation. If I don't do the drop piece table on the table, a lot of times I like to put the patient on the side. What we're going to do is cause a quick motion like that, sends a signal up to the brain, which sends a signal back to the muscles that we just stretched, and it turns them off and it releases the tension on there. So we're going to have you breathe in again and out. Here we go. And there it goes. Okay, now when it comes to the hip, we actually want to do some stretching first to help loosen up that muscle, and then we're going to do some manipulation on it. So the first thing we're going to do is find out which muscle's worse. So what I'm going to do is have you push against me this way. Okay? Take a breath in and relax. Relax everything. And then we're going to stretch everything in there. Now, push this way. Take a breath in and out. Relax. And we're going to stretch it. And then we're done with that. We actually come in here. And I'm going to get right deep in here. We're going to pull that hip and try to release it from its any restrictions in there. And there you go. That's what we do for a lot of the hip pain.